Helping physical therapists know their role in the prevention of opioid use disorder. Group 3, Katie Boydston, Shelley Dowell, Madison Payton, Jeffrey Pratt, and Emily Weiss. For our presentation, we have designed a pamphlet intended to educate current working physical therapists, and that pamphlet will be broken down for you all today. Starting with the left column, what are opioids and how do they affect your patients? Opioids are the class of drugs that act on the opioid receptors in the body. When these drugs interact with the receptor, they cause less neurotransmitters to be released, which will ultimately lead to fewer pain signals being sent to the brain for recognition. Some of the most well-known opioids are oxycodone, hydrocodone, fentanyl, codeine, morphine, and heroin. Opioids also have other direct effects on the central nervous system. This includes euphoria, which is an extreme state of happiness and excitement, sedation, slowed breathing, and confusion. There are major problems that arise from misusing opioids, and according to the peer-reviewed article titled Risk Factors for Misuse of Prescribed Opioids, in 2006, opioid addiction prevention was listed as a public health priority because there was a rapid increase in the number of users dying from overdoses. Opioid addiction has a life-changing effect on how pain is interpreted by the individuals that use them. The short time in which relief can be experienced, in combination with the euphoric feeling, can strongly appeal to users as the perfect solution for pain elimination. Over time, this leads to dependency and the need to increase the dosage in order to recreate the desired feeling that was initially felt. When the dosage is increased, it greatly increases the chance for respiratory failure to occur, ultimately leading to death of the patient. So as physical therapists, we have a major role in educating our patients. Education is especially important when it comes to opioid use. You should encourage and advocate for your patients' autonomy when it comes to their treatment options, and research has shown that an active approach to pain management is a better first line of defense than passive forms of treatment. Passive forms of treatment include, but are not limited to, medications, or opioids specifically, and invasive surgeries. Active forms of treatment are where we as PTs can step in and make a crucial impact. Many of our patients struggle with health literacy and can be overwhelmed with information that is provided to them. We as healthcare providers can step in and educate them on adverse effects related to the use of opioids. Most people understand the more serious effects such as addiction and overdose, but many may not be aware of the more non-threatening issues such as constipation, dizziness, or nausea. In addition to these adverse effects, Ellis stated that there is an absence of evidence of improvement in function and pain scores when high doses of opioids are used. One way that can be interactive in explaining these things with your patients is by using the Medscape app. It is a great reference source for practicing PTs to use a visual when discussing medication usage with their patients. Among other useful tools on the app, the Drug Interaction Checker and the Interactive Diagnostics can be very helpful in educating your patients. Now let's talk about interventions. What interventions can we provide to these patients to help improve their pain levels? First and foremost, we should always begin by educating the patient like we just spoke about. This would include teaching them pain coping and self-management skills, along with incorporating pain neuroscience education and prevention. Of course, we should also treat patients with a therapeutic exercise program to target range of motion, strength, and flexibility. Research has shown that aquatic rehabilitation can improve musculoskeletal-related pain. We can also perform manual techniques such as soft tissue massage, cupping, joint mobilizations, and dry needling to help decrease pain. Using e-stim, ultrasound, and hot or cold modalities promote tissue healing and address patient-reported pain. Implementing a combination of both pain education and physical therapy interventions was found to consistently and significantly improve patient outcomes by decreasing disability and intensity of pain in those with chronic musculoskeletal pain. And then if you look to the right bottom corner, choose BT as always. So let's first talk about pain neuroscience education. So this is a very important intervention that involves an educational program to teach patients about their pain from biological and physiological perspectives. Pain is a normal experience, but living with pain is not normal. So this can help patients really navigate and embrace their pain using the biopsychosocial approach by shifting their focus from the anatomical structures. According to research done by Adrian Lau, this has been found to be very effective in decreasing pain, disability, pain catastrophization, and with increasing physical function. It was found to be even more effective when combined with exercise and or manual therapy. And so this can be delivered in about 10 to 20 minutes during a regular treatment session. First and foremost, it involves developing a deep connection with your patient. You want them to be able to trust you and to be able to talk to you and ask questions. And it also involves simple pictures, examples, booklets, drawing assignments, pain questionnaires, PACE education, goal setting, self-efficacy. The picture at the top of this pamphlet is a graphic depiction of nerve sensitization as well as strategies to decrease the sensitization. And so a body's nervous system can be compared to an alarm system. And in some cases, that alarm system has become extra sensitive to the point where there is less tolerance for other activities. So the therapist is able to explain that using pictures, as well as able to discuss issues surrounding injury that have likely caused the extra sensitivity, including failed treatments, anxiety, different explanations about constant pain, lost hope. So once a patient understands their pain better, the physical therapist is able to derive a treatment plan to really help calm down the extra sensitive alarm system using some of those interventions we've already discussed. So what can we as PTs do to help with these things? First and foremost, we need to make ourselves known. This can involve an array of things. Reach out to the physicians and specialists in your area. It could be as simple as dropping off a flyer or as personable as holding an informational class for local physicians on a Saturday afternoon. You could provide snacks, mingle, and then give an educational presentation letting them know what you can do for patients and when they should be referred to you. Be active in your community. Let people know when you are available. Let them know what you do and what you can help with. Maybe even start a program in your community, such as a fall prevention, pelvic health awareness, exercise education. Many times, physical therapy is overlooked, and the medication opioid options are a go-to first when someone goes to their physician complaining of pain. People need to be educated. A 2017 study from the Journal of the American Board of Family Medicine looking at Medicaid recipients with new onset of low back pain concluded that a referral to physical therapy and subsequent physical therapy participation was associated with reduced opioid prescriptions during follow-up. This is just one study, but the point is that oftentimes when physical therapy is chosen first, it is often associated with outcomes that benefit the patient while avoiding the chance of developing a reliance on opioids or other medications. Next, do good work. If your patients have a good experience and make improvements over the course of working with you, they will talk. They will tell their friends and family. They may even tell their doctors. So educate yourself, research, stay up to date with your education through continuing education courses and research. Advocate for your patients. Realize when they need you to step up for them. They may be missing out on things they didn't realize they were there. Things like support groups, community exercise programs, etc. Finally, know when to refer. Confidence is key until you're just being arrogant. You cannot be confident about something you don't know. You chose PT as a profession. Help others know when to choose you as their physical therapist. Here's a complete list of our references, and that is the end of our presentation. Thank you so much.
I feel kinda free.
Get your money, man. Life goes on.
I'm hopeful, yes I am hopeful for today. Take this music and use it.